Imagine this. You've just had a baby. You're barely sure what day it is. You're holding this tiny new human, and a nurse walks in and says, "All right, time for the hepatitis B vaccine." For over 30 years, that's been standard for almost every newborn in America. But now a major federal committee says, maybe we don't need to do that anymore. Some doctors are alarmed. Some patients and parents are relieved. Some are confused. And a few are wondering whether we're about to restart every vaccine debate of the last decade. So today we're going to walk through this calmly. What's the actual risk? What does the evidence say? Why did the recommendation change? And yes, we'll talk about autism concerns because they always come up and parents deserve real answers. Hi, I'm Dr. Bobby Du Bois, and welcome to Live Long and Well, a podcast where we will talk about what you can do to live as long as possible and with as much energy and vigor that you wish. Together, we will explore what practical and evidence-supported steps you can take. Come join me on this very important journey, and I hope that you feel empowered along the way. I'm a physician, Ironman triathlete, and have published several hundred scientific studies. I'm honored to be your guide. Welcome, my dear listeners, to the hepatitis B vaccine controversy. My take. Well, before we get started, I wanted to share something. I've avoided diving into public controversies, especially when they have political overtones. That's not what this podcast is about. But in this case, the discussion around the hepatitis B vaccine has quickly drifted away from the actual evidence. And I've heard from many listeners who feel confused or overwhelmed by the headlines. So I decided to do this episode because there are real data points, real scientific insights that can help clarify what's going on. And I genuinely love your feedback. Do you want me to tackle topics like this when they surface? Should I weigh in when health issues become politicized, but still have a strong evidence base? If so, what other topics would you like me to cover? Your input really shapes the direction of this show, so please let me know. Okay, now for the beginning. So for today, we will have 8 parts to our discussion. Part 1, why hepatitis B matters for babies. Part 2, what happened after newborn Hep B vaccination began. Part 3, what's changing now. Part 4, how this decision happened. Part 5, how babies get hepatitis B. Part 6, the 2 concerns about delaying until 2 months of age. Part 7, autism concerns, why they come up and what we know. Part 8, who's right, supporters versus critics. And Part 9, my take. So let's begin with Part 1, why hepatitis B matters for babies. Hepatitis B is a virus that attacks the liver. In adults, most people clear it, but infants, completely different story. If a baby gets hepatitis B at birth or in the first few months of life, the chance of developing lifelong chronic infection is extremely high, up to 90%. Chronic hepatitis B can lead to cirrhosis and liver failure and liver cancer decades later. Before the vaccine was introduced for babies in 1991, about 18,000 U.S. children became infected every year. That's a huge number for a disease that's so preventable today. That's where universal newborn vaccination came in. Well, Part 2, what happened after newborn Hep B vaccination began? And that is now the topic for us. In the early 1990s, the U.S. recommended that all newborns get the hepatitis B vaccine before leaving the hospital. The result? Childhood hepatitis B plummeted. Within 10 years, infections dropped by roughly 2/3. Today, they're down over 95 to 99% from where we started. And importantly, after hundreds of millions of doses worldwide, there really have been no new safety concerns associated with giving newborns the hepatitis B vaccine. So why change anything? Let's look at the new proposed guidance. Part 3, what's changing now? Recently, a federal vaccine advisory committee, ACIP, voted to change the guidance. The proposal is if the mother is hepatitis B positive, baby still gets the birth dose. If the mother's status is unknown, baby still gets the birth dose. If the mother tests negative, the baby may wait until 2 months for the first dose and have a shared decision-making discussion with her doctor. This is a major shift away from all newborn babies get it while in the hospital. Now, it's not final until the CDC director approves it. Keep in mind that other organizations may still recommend the birth dose. The American Academy of Pediatrics has already said they plan to keep recommending the birth dose for all newborns. Why the difference? Well, that takes us to the process. Part 4, how this decision happened. This review committee cycle was different. The committee was reconstituted, meaning many long-standing expert members were removed. Several new members, including individuals who really didn't have medical or scientific backgrounds, were added. Some participants in the actual meeting were known for vaccine skepticism, and their presentations did not always reflect the scientific consensus. Crucial, there was no new safety concerns, no new adverse event signals, and no new evidence showing harm from giving newborns the vaccine. Instead, the arguments for changing the policy centered on, the current low rate of hepatitis B in U.S. infants, parental autonomy, the belief that maternal testing is reliable enough to skip universal birth dosing. Meanwhile, CDC scientists, pediatric infectious disease experts, and public health organizations strongly disagreed with altering the universal approach, warning that reducing coverage, even a little, could lead to preventable infections. The process itself raised some concerns among professionals. Policy changes should be driven by robust evidence, not by shifts in committee membership or ideology. Well, let's step back and look at how babies actually get hepatitis B. Part 5, how babies get hepatitis B. And let's begin there. Some might be thinking, hepatitis B is a sexually transmitted disease, so I shouldn't have to worry about my baby. Others might think, hepatitis B in babies comes only from mother-to-child transmission during birth. Well, that is the biggest risk, but it's not the only one. Young children can be exposed through bites that break the skin, open sores, contact with tiny amounts of infected blood, shared household items, toothbrushes, razors, nail clippers. The point is, exposures can happen, and you may not know who in your broader family or childcare circle has chronic hepatitis B. The birth dose was designed to protect infants from all of these uncertainties. All right, part 6, Dr. Bobby's 2 concerns about delaying 2 months. Let's break down the 2 main worries. Concern number 1, infection in the first 2 months. It is a short window. The risk is low, but if a baby does get infected early, the consequences are lifelong. The dose at the hospital protects against the unexpected. A misrecorded maternal test, a missed test, an unrecognized household exposure. These things happen more often than we'd like. Concern number 2, will babies actually get vaccinated at 2 months? This is the big one. Right now, the birth dose ensures nearly universal coverage because the baby's literally right there. The healthcare team is present. There's minimal friction. If the first dose happens at 2 months, you introduce friction, missed appointments, parents who are hesitant, logistical challenges, mixed messages from social media. Maybe we'll wait, becoming maybe we won't. Even today, about 9% of parents delay or skip the hepatitis B vaccine. A policy that makes delay the default almost certainly increases the number of unvaccinated children. All right, part 7, autism concerns. Why they come up and what we know. The full autism discussion needs an episode or many to fully explore, but we need to at least touch on some of the issues. First, empathy. Parents want to keep their children safe. Autism diagnoses have increased. It's understandable that people are looking for causes. Well, let's go to the evidence. In my opinion, vaccines don't cause autism. This view is backed by lots of studies, tens and hundreds of thousands of children, reviews by major scientific bodies, research on the MMR vaccine, the stuff in it like thimerosal, aluminum, and total vaccine exposure, all show no association between vaccines and autism. So why are autism diagnoses rising? Again, for another day. But most likely reasons: broader diagnostic criteria, better awareness, better screening, environmental factors not related to vaccines, things in our food, pollutants, or factors we just don't know yet. Autism is complex, but vaccines have been studied a lot and consistently shown not to be the cause. And there's no evidence that specifically links hepatitis B vaccines to autism. All right, part 8. So who's right? Part 8, who's right? Supporters of the new guidance say hepatitis B is now rare in infants. If mom is negative, the risk is very low. Parents should have more control over newborn decisions. All reasonable points. Critics say, though, even rare infant infections can be serious. Testing moms isn't perfect. Household exposure happens. Vaccine hesitancy is rising. So adding friction may reduce kids getting vaccines. The policy process was influenced by non-experts. Both sides raise legitimate points. So where do I land? Part 9, my take. If I were designing national policy, I would keep the universal birth dose. Why? It's safe. There's no new evidence to say that it isn't true. The vaccine works extraordinarily well. It protects against real-world gaps. The proof is in the pudding. Infant hepatitis B infections are rare because the system is simple. But I also want to be clear, this change is not catastrophic. Parents can still choose the birth dose. Hospitals can still offer it. Pediatricians can still recommend it. And most babies whose mothers are hepatitis B negative remain at very low risk. My advice for parents: know your own hepatitis B status, make sure it's documented correctly. Strongly consider the birth dose, even if you test negative. If you delay, commit to the 2-month appointment. Rely on your doctor, not social media. Public health works best when decisions are evidence-based. All right. Our closing. So that's my take. Balanced, calm, and grounded in the evidence. The hepatitis B birth dose is one of our most successful public health interventions. I believe maintaining universal newborn vaccination is the safest choice. But even if the recommendation shifts, parents still have strong options and the situation is manageable. If this episode helped clarify things for you, please share it with expecting parents, grandparents, or anyone confused by the headlines. I'm Dr. Bobby Du Bois, and this is Live Long and Well. Stay curious, stay thoughtful, and I will see you next time. Thanks so much for listening to Live Long and Well with Dr. Bobby. If you like this episode, please provide a review on Apple or Spotify or wherever you listen. If you want to continue this journey or want to receive my newsletter on practical and scientific ways to improve your health and longevity, please visit me at drbobbylivlongandwell.com. That's doctor as in DR, Bobby, livelongandwell.com.